Hi guys, welcome back to the channel after the weekend. Today we'll be starting with the treatment and management part of ameloblastoma. Okay, let's start. Treatment goals: complete removal of tumor, aesthetic reconstruction with minimal disfigurement, good prognosis, and long-term follow-up. Best treatment depends on the best judgment. Plan to be executed should be based on lesion if it is present in maxilla or mandible. Maxilla has more cancellous bone, so facilitates spread of tumor, whereas mandible having thick dense cortical plates which limit the spread of neoplasm. Okay, treatment can be palliative or conservative, and it can be curative or radical. Okay, palliative treatment may be achieved with enucleation and curettage procedure or with marsupialization or liquid nitrogen. Is indicated in individuals who prefer palliation over curative resection, for example in very young or too old patient for whom aesthetic and surgical risks are too great to undergo curative resection, for example in medically compromised patient. Okay, recurrence with enucleation and curettage procedure is 70 to 85%, but will take about 5 years to become clinically apparent. Enucleation and curettage has a potential for tumor seeding also. Okay, so palliative therapy should be carried out in association with chemical cauterization with the help of modified carnoid solution and peripheral ostectomy. So whatever we are doing, if enucleation, mask soap or anything we are doing, it should be carried out with association with chemical cauterization if we are giving a palliative treatment or therapy. Okay, with the help of modified carnoid solution and peripheral ostectomy. Initial treatment should be conservative as tumor has a low metastatic potential, and radical treatment to be done in case of recurrence only. Okay, use of carnoid solution. Or what is carnoid solution? It is alcohol 6 ml, 1 ml glacial acetic acid plus sclerosing agent, that is ferrous chloride 1 gram, and 3 ml chloroform. But it is discontinued as it is a known carcinogenic agent. So in modern carnoid solution or modified carnoid solution, chloroform is not used. Okay, it is not used. Effective in unicystic ameloblastoma and mural ameloblastoma. It's applied for 5 minutes with gauze and then irrigated with normal saline. Okay, now coming to the management part. Before starting the surgical part, let's get a brief discussion about the management part. So in mandible, the type of the treatment module depends on different things. First is the type of surgery, depends on the number of factor, type of pathology, benign, extent of involvement, sufficient lower border of mandible is present or not, site of tumor, it is anteriorly placed or posteriorly. If anterior tumor is there, then approach conservatively. Infiltration is less due to thick cortical bone. Large lesion with cortical perforation, marginal mandibulectomy is done. Okay, for posterior mandible, marginal mandibulectomy, recon plate is used, and dental rehab with implants. Okay, I am giving just a brief idea how the management is done if the lesion is in mandible or when it is in maxilla. Okay, treatment starting from the most conservative to the most radical. Access incision, intraoral or transmucosal access, combined intraoral plus extraoral submandibular incision, intraoral or viscer incision. Repair is by primary mucosal closure, packing cavity and healing by secondary intention, or it can be by recon plate with primary mucosal closure, or recon plate with free bone graft, or vascularized bone free graft flap. Okay, so that's all for today. Next class we'll be dealing this management part, or the brief idea about the maxilla and some of the surgical procedures in mandible. Okay, till then, like, share, subscribe and comment. Bye.